all that you've done to raise up an issue that is near and dear to my heart. Really appreciate the work you and George are doing. And if you all haven't had the opportunity to see the op-ed that George and Jim put out last week, we'll make sure we get it sent to you all. I think it really summarizes the problem. But I want to tell you all a little bit about me and my professional and personal interest in this issue. Back in 2014, Mike Pence asked me to be his state health commissioner. And at the time, neither of us thought we would be focusing on addiction as part of that tenure. We really, at that time, intended to focus on maternal and child health because Indiana had, at that time, the highest infant mortality rate in the nation. And interestingly enough, in the way that God works, we ended up having an HIV outbreak related to injection drug use in Scott County, Indiana. And the very first case was in a pregnant woman. And so that's how we discovered the first case. But for those of you who don't know about that or who don't remember, in a small rural community where they never had more than 3 HIV cases in a year ever in history, we had over 100 cases of HIV related to injection drug use in the first year and over 200 cases related to injection drug use total in that outbreak. And as part of that, Governor Pence, you all know, a very conservative individual, very vocally opposed to harm reduction, he and I had to come up with a plan to help turn this outbreak around. And we had to get to a place where we were able to get the state to embrace harm reduction. We instituted a syringe service program, but what's interesting about that syringe service program is many people talk about how we were able to stop the transmission of HIV, and that was incredibly important, but it also allowed us to have a conversation about naloxone and overdose prevention. And I still feel that we saved far more lives because of the conversations we had around naloxone. Many of you know Justin Phillips with Overdose Lifeline in Indiana. We were able to get the laws changed and really spark a national conversation about what was going on in our country, about how it wasn't impacting the people who we traditionally think of when we think about substance misuse, and how we needed to take a new and fresh approach to harm reduction, meeting people where they are. I'm looking at the pastor over there and former congressman, you know, the faith community really had to wrap their heads around the idea that Jesus met people where they were, and harm reduction is about meeting people where they are. So that was, you know, the big thing that I was known for during my time as the state health commissioner. Governor Pence became Vice President Pence, and my name got thrown into the hat to be Surgeon General of the United States. And you know, again, by God's blessing, I was confirmed, and again had I wanted to focus on mental health and substance misuse, but we were hit with 3 Category 5 hurricanes when I took office, and so that kind of took up our attention at the time. But what's interesting is this is where my personal story comes in. When I was in the White House being confirmed as Surgeon General of the United States, my brother was in a prison cell in Jessup, Maryland, you know, about 10 miles away from here, 10, 15 miles away from here, due to crimes he had committed to support his addiction. So I tell you that because this is something that's very personal to me and to my family. And I'll also be very honest with you all. When I was going up for my confirmation hearings, I was discouraged from talking about my brother because there was a fear that would cast a bad light on me as the nation's doctor if people found out I had a brother who suffered from substance use disorder. And those of you who know me know that I'm nothing if not transparent. And fortunately, then Vice President Pence was very supportive of me. President Trump was very supportive of me talking about substance use disorder. And I know we're in a crowd of people, and there are going to be people who love him and people who hate him, but I will tell you that one thing about President Trump, I said he was always very supportive of our efforts to combat the opioid epidemic. But I got that support, and I got my own brother's permission to talk about his story. And I ended up spending most of my tenure before 2020 going around the country and sharing my story and my brother's story, because that's how you lower stigma. You lower stigma by talking about things. Stigma is when we separate ourselves into us and them. And when we talk about the issue, we help people understand that there is no us and them. We're all in this together. And I can't tell you how many times I shared his story, and someone would come up to me afterwards and share their story and tell me they'd never told anyone else about this. They come up in a hush whisper, I've never told anyone about this, but my brother, my son, my uncle. And I tell you that because that's a lot of what we have to do here too. We have to combat stigma in order to overcome this crisis. And it still is a crisis. You may have heard the good news out there. The good news is that we're seeing overdose rates start to go down for the first time in quite a while. The bad news is we still have several hundred people dying of an overdose every week. And certain communities, particularly African American community, Native American community, the numbers are still going up. So we still are in a crisis. We still have a long way to go. And when I was Surgeon General, I ultimately asked myself, what can I do personally to lean into this issue? And I decided to put out the first Surgeon General's advisory in over a decade, and that was focused on naloxone awareness and availability. Because it's also easy to forget this, but back in 2018 when I put out that advisory, there were still fire departments and police officers and first responders who were refusing to carry naloxone because they felt they would be enabling substance misuse. And so we had a lot of work to do, and I said, if I, as Surgeon General of the United States, can help lower the stigma, and some of you have heard me say this before, stigma kills more people than what fentanyl does. Because it keeps people from being willing to offer help, it keeps people from accepting help. If I can help lower that stigma by using my bully pulpit, then that's what I'm going to do. And I'm proud to say that we put out that naloxone advisory, and we saw naloxone dispensing nationwide go up by 400%. And I take no credit for that because it was a team effort. But if you actually look back to when we started to see the tide turn, resulting in this decrease in overdoses, it traces back to that time when we first started really nationally focusing on naloxone availability. So, under President Trump's tenure, we had continued discussions, and this has been bipartisan, about the opioid settlement dollars. And so now we have opioid settlement dollars all over, have hundreds of millions of dollars going out there. But I want to tell you all another quick story. We had this happen before. We had tobacco settlement dollars, and they went out to states and communities, and they didn't actually go towards helping stop people smoking. They went to fill potholes and roads, and to backfill budget shortfalls in states and in counties. And so we've seen this play before. And I'm very concerned that while we're excited about these opioid settlement dollars that are going out, that there's not really a plan to utilize these dollars in an evidence-based way to help stem the tide. So Q, Jim, and George reached out to me and said, we want to figure out what we can do to deal with this crisis. And I said, well, one thing that we know works is naloxone, is opioid overdose reversal. I'm an anesthesiologist. I still work in the operating room 1 day a week. If someone comes in bleeding, the first thing you got to do is stop the bleeding. There's a lot more you have to do after that, but the first thing you got to do is stop the bleeding. And naloxone allows us to stop the bleeding. It allows us to save the life, because you can't do any of that other stuff if the person is dead. And so we said, let's put together an organization that really rallies people around this moment where the money's out there, where the stigma is being lowered, but where there's a lot of people throwing spaghetti at the wall. Let's try to figure out how we can get everyone focused in on something that we know works. And you'll see in the op-ed that Jim and George wrote, there's actually a county that has done this. And many counties have done this, but one where we can quantify, where they literally intentionally said, we're gonna flood the community with naloxone. And they were able to significantly lower their overdose rates. And that's where we come into the 25, 25, 25. And I threw in the last 25, even though Jim and George didn't, but I love threes. We're going into the year 2025. And in 2025, we want to challenge everyone to commit 25% of their opioid money to lowering the overdose rate by 25%. Why? Because we know that if you do that, you actually will turn around these numbers. And so I'll finish by saying that in order to do that, we need every single one of you. And I know I'm preaching to the choir here. I know that all of you all are working in this space, but what I hope is that we all can leave tonight and speak with one voice around the issue of really blanketing communities across the country with opioid overdose reversal agents. OPVI is a sponsor of ours too. Naloxone has now become a generic drug, but it's also become a generic term for opioid overdose reversal. But we want people to be aware of the risk that they're at. I've talked with many of you all about how we've also had to shift the national mindset from thinking about persons who use drugs intentionally to increases in accidental overdoses. And we have a lot of people in here who live and breathe this stuff, but for those of you who don't know what I'm talking about, there's someone who goes out and buys heroin, knows they're injecting heroin. We want those people in particular, because they are at incredibly high risk, to know about and have access to naloxone, ideally to carry it on their person. But I work on a college campus. There's a lot of kids out there who didn't go out and buy heroin. They went out and bought what they thought was Xanax, or they went out and bought what they thought was Ritalin. And unfortunately, a lot of these drugs are counterfeit now. And they're counterfeit and they've got fentanyl in them. And so these people are accidentally overdosing. It's not the folks who you would normally think of as being at risk. The opioid epidemic continues to evolve. And so we want people to understand who's at risk. We want people to understand the places that are high risk, concerts, parties, any place where people are passing out these pills, in addition to, as I mentioned, persons who are knowingly injecting opioids. And we want them to have access to naloxone so that we can save that life. We need your support. We need your sponsorship. And when I say sponsorship, that can be financial, but it can also be in kind. It can be your expertise. It can be you just going out there and sharing Jim and George's article to help people understand what we're focused on. But we need your support and sponsorship. And if we do that, I know that we can save lives. We can save a significant number of lives this year and moving forward. And once we save those lives, then we can focus on, Jim talks about meds and beds. We want to make sure we're getting the meds, the Narcan out there, the naloxone, so we can save the life, and then transition people into recovery, into treatment, and then long-term recovery by creating recovery-friendly communities. But again, we can't do any of that until we save the life first. So I've been going on. We're going to have some Q&A on the back end if anyone has questions. But I just want to thank you for being here. I want to thank those of you who have supported us. And I want you all to think about who we need to be inviting to be a part of this conversation. Think about where we need to be having summits moving forward, and think about how we can actually rally around the opportunity that we have right now to save some lives. So thank you, Jim.